Hi, you guys. Welcome back to our daily practice questions. As always, I like to first introduce myself and get into my disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer because we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of the videos that you may see where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. All right, so question number one states a patient presents to the office with complaints of dry, scaly areas to her elbows and knees. She states that it itches and she can't find anything that improves the dryness. Upon examination, the nurse practitioner notes silver plaques to the elbows and knees with noted occiput sign to the left elbow. Based on these findings, how should the nurse practitioner diagnose? Is it A, atopic dermatitis, B, contact dermatitis, C, psoriasis, or D, pityriasis rosea? Take a moment to tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure that you're answering what is being asked of you. So here, the stem of the question states, based on these findings, how should a nurse practitioner diagnose, right? And I always tell y'all, if they're asking for a diagnosis, you need to run it back and look at the assessment findings. How are they presenting? What are they complaining of? What are you finding on exam when you're assessing this patient, right? Because this is going to tell you the whole story. So this patient came in. She's complaining of dry, scaly areas to her elbows and knees. They're pruritic. She said they itch. She can't find anything to help with the dryness. And on exam, the nurse practitioner notes silver plaques to the elbows and knees and occiput sign to the left elbow, right? So y'all, excuse me, I always say location, location, location with derm, right? So you start to think of those differential diagnoses of things that we commonly find on elbows, knees, dryness associated, right? So as you're processing through, you're probably starting to think of your eczemas, your psoriasis, things of that nature. But then you have to be able to differentiate all the way down to the least common denominator, is what I say, right? But I always tell y'all when I say this, you say that. So if I say silver plaques or silvery plaques, you say psoriasis, right? So that's a key identifier. And then also occiput sign is also classic presentation with psoriasis because what happens with this occiput sign is just, the scales, they have scratched it so much and it caused the plaque to come up. So there's just like a little pinpoint bleeding area there where they've just peeled the skin basically. So you can see that commonly from the scratching or itching or what have you. But this is classic presentation for C psoriasis. Question number two, the nurse practitioner and NP student are discussing psoriasis and the best steps to diagnosing. What is the most important method for diagnosing psoriasis? Is it a blood test for autoimmune markers, B, skin biopsy, C, a physical exam and obtaining medical history, or D, an allergy patch test? Take a moment and tell me what you got. All right, so stem of the question here states, what is the most important method for diagnosing psoriasis? So here is another classic question that the stem is telling you exactly what you need to know, right? What they're looking for, I should say. So what is the most important method for diagnosing psoriasis? The best answer is C, that physical exam, just like we talked about, looking at it, seeing that scaly plaque and things of that nature, knowing about this occiput sign, and then obtaining a medical history because seeing if they have a family history or other factors that may contribute to this, okay? And then lastly, question number three, the nurse practitioner and NP student are discussing the best treatment options for psoriasis. What is the first line therapy? Is it A, oral antibiotics, B, topical corticosteroids, C, methotrexate, or D, corticosteroid injections? Take a moment and tell me what you got. And stem of the question here states, what is the first line therapy? So, first line therapy, again, if they're asking you for a treatment in the stem of the question, run it back and see if they provided you with a diagnosis. If they have, then you're going to try to figure out how we treat this and what are the best ones first line based off of what they provided here. If they have not, then you're going to run it back a step further and look for those assessment findings, right? So they have provided it. We're looking for the first line therapy for psoriasis. And your best answer is B, topical corticosteroids, okay? Topical corticosteroids, B. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. Ooh, y'all. Also, I am doing something for you guys today. Just a sneak peek on what's up and coming for our holiday deals for you guys. You know, I have some exciting stuff for you, but you will get an opportunity to get a chance at getting one of those today. So be on the lookout for that post and video, okay? And if you need any of the resources that I do offer, y'all feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you prefer to study independently, my self-paced review course for family and adult Gero is linked in the bio of this channel. If you are looking to do practice questions, the Q banks are linked in the bio of this channel. And as always, if you're looking to book any sessions with me, I always say either call, text, or email, as I offer a variety of one-on-one session types. So we need to gauge what you truly need so we can make sure you're booking the appropriate session, okay? But y'all know what to do, you guys. Make sure y'all meet me back here. Happy studying. Bye, y'all.